which one is inside and which one is outside? This one or this one? Let's see. Hello guys! How are you? I hope every one of you is good and doing good and safe, of course. So, welcome back again to my YouTube channel! So, I'm alone. This is me, Joyce, again. So, what we have for today is I received one comment. Oh, small YouTuber, but received one comment suggesting to make the video regarding anything regarding what I can say about COVID-19. Especially, I'm working in hospital, but I cannot mention which hospital, and I cannot give some clips where I work or like this because this is private hospital and it's not allowed. So, let's talk about it. Okay. So, first of all, COVID-19. By the way, guys, disclaimer, okay? I'm not medical, what you call this one? I'm not nurse, I'm not doctor. I don't know exactly all the medical terms. I just want to share what I know, because especially I'm working in hospital, we receive some training, especially in COVID-19, I receive some trainings, correct information, procedures, safety procedures, so how we can prevent. Thanks God, until now, I'm safe. But I hope I will be safe until the end of this COVID-19. COVID-19, whatever. So, okay, so let's start. COVID-19, how we can prevent. First of all, if you don't have anything outside, number one, stay inside your house only. Don't go outside, guys. My God, someone is making noise, but it's okay. That's life. That's normal. So, because I'm living other topic, I'm living in the sharing flat, so I'm not alone here. So there's other person also doing their household chores. So, by the way, see, so stay at home. Okay. What else? Because we know nowadays there is news regarding COVID-19, because before they are saying it's droplet, it's not airborne, but now there is news that um, they are saying that it's also airborne. You know, for me, I'm not expert, I'm not in the medical field, but for me, I think I'm believing that it's airborne, because just example only, by experience in my work, too much of my colleagues get infected, although they're wearing full PPE, they're doing the safety procedures, but still they become infected. I don't know, guys. So that's only in my suggestion. That's only my opinion regarding this one. If it's airborne or droplets, I think it's airborne. For me, whatever these droplets or airborne, if we can stay at home with our family, this one, avoid going outside, it's better, because that's the only thing we can save ourselves. Okay, so what else I can tell about the COVID? How I prevent the COVID to become infected by COVID in my workplace, or in not in my work, also in outside of my work. First of all, outside of my work, I'm not going outside, guys. I will just go outside. It's either I will buy grocery or I have important things to buy outside. That's the two things only I will go outside. In my workplace, I cannot guarantee to be safe, but as far as I can, I'm doing all the safety procedures that the hospital management is teach us. So, especially, you know guys, I will tell you something. I'm working in private hospital here in Kuwait. Private hospital is not conducting the procedure or swab test. We're not accepting what you call this one, we're not accepting the patient with COVID-19. So for us as in the private hospital, we are evaluating the patient if this one is possible with coronavirus. We are referring them to the ministry hospital, government hospital. So me, I assign in emergency department. We have another under emergency department. We call it redo. This is wait, what is redo? Respiratory. What is this redo? Respiratory something. Just human, guys. This is respiratory. Sorry, guys. So I will just put here. What is the meaning? Later I will edit. I will just put here. Sorry. Okay. This one all with the signs of corona. They are putting there, so I'm in the higher risk, but thanks God until now I'm okay. But they are choosing only because there's some patient that they have signs, but they need first aid treatment, like if the patient is too much weak, like too much vomiting already, too much in pain. Of course we need to receive the patient. We need to receive the patient so the doctor can give first aid for them, some injections like this, before they will refer to the ministry or government hospital. I'm working there, I assign there, so still praying that until now I'm safe. I don't feel any symptoms, and that's also first thing, guys. Prayers. Pray. I pray to God. I hope that if corona will catch me, my family or my friends, my loved ones, I hope we will not get we'll get soon better. We can recover, we can make it. It will be easy for us, because actually guys, I will tell you something. Not all corona case is they are what you call this one, they are suffering too much. There is some patient that it's like nothing, guys. Sometimes they get fever because of the immune system, guys. If the body has very good immune system, it might like only very a simple flu only. I know some of my colleagues, they become positive, but they don't feel like too much pain, too much like this. No, they just feel they have fever, and then or little bit body pain, only that one, and then by only Panadol or paracetamol, they survive. They become recover very fast. So not all corona patient will direct to the worst. You know, it depends on the immune system. That's why, guys, if you are still not infected with corona, you should have proper diet. Not proper diet to become sexy. Proper diet, eat healthy food, vitamins, everything that will be good to the immune system, we should take. So if ever we will be infected, our body can kill that virus. I will show you something. Okay, I will just cover the name of this Okay, you see this one? This is the face shield that we're using in hospital. Okay. But, I covered the name of the hospital, guys, because cannot. But I have another one. This one I buy online. Like this. Actually, that one is, the another one is better. Because there is no air. We'll, can use this one like this. Okay. This one I'm always washing. But this one is very easy to wash. Because there is no foam. The other one, if I put soap, it will be too much bubbles. So, what else? I'm using that one. In my workplace, I'm using N95 because I'm in the department which is very risky. But anywhere is very risky, but for my department, that's the most risky department. But as what I said, thanks God, I'm still okay. So, okay. Now I will disclaimer again, I'm not expert. I'm not in the medical field. I'm not doctor, I'm not nurse. But for those regular people out there who can maybe can help this kind of video, I will show you how to use properly a mask. Wait. Okay, I'm back. My Canon camera finished already the battery, so I moved to my iPhone mobile. So what I'm saying now is about mask. Okay, we have this kind of mask. I will show you this kind of mask because this one is very important for those who still don't have proper knowledge regarding mask. See this one, color blue. There is also, I saw some mask, there is other kind of design but colorful outside and then white inside. Okay, then I have another one, plain, both plain. So what is the difference, guys? Okay, it's better I will show you like this. Okay, you can see this one. See this one, they sew it inside. Okay, they sew it inside. This is the one supposed to be in your face. The one attached in your face. How you explain it? Whatever. The one supposed to be inside, not outside. See the another one? See this one? This is outside because this is the one inside. Focus, please. Okay, so that's how you will check. And then of course you will check where is the hard thing. This is like that. Okay, and you need to pinch in your nose. See, my hand is already carbon. It's already too much allergy, too much red. This one because of all the alcohol and all the chemicals that we're using to sanitize ourselves. So guys, that's about the mask. That's how what information I can provide to you about mask because this is very important, guys. And then what else, guys? I'm using the mask. How you will wear it correctly, the mask. Okay, first of all, when start to use this one, it's okay to touch, no problem, as long as your hand is clean. Okay, you will wear it. Okay, then you need to do this one. I hope you still can hear me. After you fix this one, so what I'm saying, guys, this outer part of the mask is very dirty, guys, because all the air that you don't want to take it by yourself, it's coming here on this side, on this part. And also inside is also dirty because inside is from your own dirt, and then from outside, dirt from other person. It's coming here to protect you, for you to not receive that bacteria or virus from inside, from your own bacteria. You might have corona, you might have other bacteria or virus that you're avoiding to transfer to other person. That's why you have mask. for you and for others. So how we will remove it, yani not remove direct, like direct throw. If for example you're in the middle of the duty and you just want to drink something, how you will just remove it and then put back again. Okay, you should do this one carefully. You should hold only from this, from the, what you call this one in English, I don't know, whatever. You can hold only this one, carefully put it down. Disclaimer, I'm not in the medical field. Whatever. So okay, for me this is better. Okay, and then you can hold with another, you can hold with your another hand and direct, and then put back again without touching. There is already mold, how you fix it before, the form in your nose, so you just like puzzle. Okay, so no need to touch. Okay, because if you touch on this part, your hands will be dirty. Okay, and then how you will remove it, like finish, you will just throw it, and it's not reusable, guys. You cannot wash this kind of mask. Okay, again, hold this one here, garbage, throw. Okay. So now we have visitors already. He will teach you guys. Nag-shake. He will teach you guys how to carbon.
You record?
Oh. You will teach them how to sanitize properly the hand, like this one. And guys, you know, not only because you spray alcohol or put sanitizer on your hand, it doesn't mean you kill already the bacteria. You should kill them. Kill. Not only putting like this, tapos na. Finish. It's not like that. No need to see it. Show lang yung kamay mo.
Yeah, but
Ano ba yan? Show lang yung kamay mo. Yan. Okay. Put enough sanitizer or hand grab.
Ayaw ko na ito ko.
Wala na yan eh. Ubus, finish na yan. Okay. Finish na eh. Out of stock na eh. Enough. Not only too much. Not ano ba yan? Not little.
Okay.
Okay. And then what you will do is, you need to rub with little bit force. You need to kill the bacteria, guys. Okay. Not only applying, here. You should, make it, and don't be kuripot. What kuripot? Yung ano? Don't think about how much the alcohol. No problem. It's for your own safety. Yeah. With the force, little bit force that one, guys, because you need to kill the bacteria. Not only apply, you should kill. Okay? Should be, ano yun? Should be the liquid will be dry itself by your hand.
Should be dry.
Not putting like this, and then that's very wrong, guys. Okay, so that's what about this one. Again and again, I'm not in the medical field. I'm just sharing what I learned from my trainings and what the welcome.
We are working in hospital, guys. That's why
Excuse me.
Yeah, just now I sanitize already.
So sorry for interruption because I need to wait for him. So because he wants to share something. Okay, what you want to share something? Say hi first to our viewers.
Hi guys.
What you want to share about Corona or something related?
Today's
to
topic is about Corona.
COVID.
Sorry guys, I was in duty. She already started shooting the video, so I just came in the middle of this video. It will be middle or in the front?
Middle na, no?
Okay.
Yun, front ko yun.
So it's basically all about the Corona, life before and after Corona. As you all know that we are working in hospital, so our life is completely changed with the Corona. In work also and outside the work also. Here in Kuwait.
That's why they call it the new normal.
Yeah, the new normal. Nice one. before corona our life is as normal as other profession, but as we are working in hospital now, our profession is like it's totally different than the other one. Since corona came, we didn't stop, sir. Other profession, they have vacation or they stop, they close, but our hospital, it didn't close, it's still working. And then
There is advantage and disadvantage for that one.
yeah,
Give the
Uh,
advantage one.
advantage is like
Salary.
they stop, they never stop paying us.
Of course, where we
Still
are
we are,
working.
yeah, still we are getting our paycheck.
Wow.
And then we don't need to like we still
Because-
sending money in house, like
Because
everything
that's why we're
financially,
here.
we saw that in the one working in restaurant, hotel,
Restaurant,
still they are not getting
other,
the
especially other
other
small
profession.
small companies. My God, I don't know how they are. How many
Yeah.
months already? For sure, their company cannot afford them to give the salary every month. So what is the disadvantage?
advantage. Only that one.
Oh,
Other advantage is like we get too much of knowledge about how to protect yourself from the viruses, like in this kind of pandemic. What are the sanitizer, how to use, how to wear mask,
Proper.
everything they give training,
proper
and we
training.
become trained on that one. And talking about the disadvantage, there are pretty much disadvantages, guys.
Okay, how many? I will count until 10.
Too many.
Too many.
First of all, there are there are chances,
Big chances.
yeah, big chances of becoming
Infected.
by corona.
Second.
One is we need to work more hours than in the regular days, because some of our friends are already positive,
Infected, so
they will go for leave for 14 days or like that. So we need to
sometimes
cover
it's
that
more
one.
than that one.
Yeah,
and
we
then
need to
if
cover.
worse, they will not come back. That's the
Yeah.
saddest thing. They will be like in leave, or so the staff will be what do you call this one?
Shortage,
A shortage of staff. So
And then
the
we need
one
to cover
remain
need to work hard.
need to work hard.
And
But
then it will again create the possibility to have
To be
infection.
infected
more,
very easy because-
the more the more time you spend in hospital, the
And-
more it
Yeah.
chances of
And then in this time you should take rest properly,
Yeah.
like this. You should have good physical, emotional, and not only physical, guys, should be also emotional, because if you're being in stress, and then your immune system will be
Down.
down also. That's by the doctor, they said. Not from us. So what else? There is any disadvantage?
All the disadvantage is like
We will be prone more.
yeah, and what we call this one.
For us, we want to stay at home. But what we will do,
Yeah.
we are working in hospital, so we don't have choice.
We don't have that.
But the other person don't. For them it's good. They're receiving money, but they're still complaining that they are bored in home. They're not doing anything. They are very
lucky in a sense. They are lucky.
They're
Like,
receiving the salary, and then they're still safe. So they are lucky. But for us, we don't have choice.
mhm.
So,
Yeah, that is another disadvantage.
So what else you can say about this one? I've been waiting for you because
Okay, about the after corona happened, like our life is totally changed. As I told you earlier, we planned vacation to this like what 1 month before, sir. So that is also cancelled because of the corona, so we cannot go back to our countries.
and this vacation is very special vacation supposed
Yeah.
to be. So what we will do? tissue. No, it's okay. That's God's plan.
Anyway.
Maybe next year it will be more good, or it will be
Yeah.
more.
But the good thing is still we are not positive of corona.
Yeah.
And don't be.
We've been try to be quarantined.
Yeah.
We've been try. That's one before when it's corona starting.
Yeah, we get tested already. She get PCR test one time, and I got PCR
He's the
test
one
two
first.
times. Yeah, 2 times. That
He's
is
the one
that
first.
is really a difficult time, guys, to wait
But
for
he don't have, guys,
yeah,
we
to
both of
wait.
us, we don't have the symptoms. It's just before when the COVID-19 starting. If you face one patient or
Positive
anyone
with the
that is
corona.
positive, and then they will show in the camera that you interact with that person. They will send you to the ministry to check the swab, and then wait for the you will be in
Yeah, that's
quarantine
called the
procedure
contact
before
tracing. They trace
that
the
one.
all the person who
But
came in
now,
contact with
but
positive.
now, no.
Yeah,
You should have symptom first because it's too much already. The ministry, we understand also the ministry cannot handle it already. If for sure, for us, how many patients for sure, how
yeah.
nowadays we are facing that it's positive, but thanks God we are still safe until now,
Mm-hmm.
and we don't know until when. But I hope if we will become infected, it will be like other person, like it's easy for them,
Yeah,
because there's some person like it's going smooth. I hope.
yeah. Even our my colleague, like how many they are
Mm.
positive already, but
Now it's like
they
normal.
they get through of that one, and then they are back in the work already.
Yeah.
So because they are young, and then they don't have any other complication in
Maybe good
health.
immune system as
Yeah,
well.
they came back in 14 days or less than that one also.
Mm.
But this one is more dangerous to the people who has already health complication like
Yeah.
diabetes, some other complication. It will attack more, and there
Blood
is a life
sugar,
threatening.
and
Yeah,
then the one little bit old
yeah.
already.
These
That's the
kind of
problem.
person are very in danger, guys. You know.
Yeah. That's what
That's
happened to one of my colleague. He's old already. I hope his soul is in the good hand already.
yeah. One of our colleague was old, and then he has diabetes,
Too
diabetes,
much complication.
and
Especially my
he
colleague. My
got,
colleague.
yeah, he got infected with the corona, and
Mm.
he's no longer
Yeah.
here.
Nakalas-kalas, maybe
Yeah,
okay ka rin.
yeah. He passed away, guys.
Yeah, maybe I will cry again.
Yeah,
Yeah,
that's
so
life. What to do, and
yeah, well, he's in the God's hands already, guys. So
mm.
leave it to God. So what we will do? So what else we can talk? Change the topic. Maybe I will cry.
See, her eyes is tearing up. Okay, then what else we can talk about corona? Yeah, how we can prevent this one? How we
I tell
can?
already that one, but it's okay. Tell.
You tell already?
Tell or by your ano. So let's see
Yeah,
if
for me, guys, if you want to prevent it, like, uh, now we cannot, always stay in the house, and then maybe other complication will come, like
Uy, it's not filming. Joke.
mental complication, and then financial complication. So we need to live through this one. What we can do is we need to
Make our mind
yeah,
stress free.
build up the immune system,
Mm-mm.
take supplements, vitamin C, and this kind of thing, and the regular exercise, avoid the
No,
as,
joking only.
yeah. And then and then avoid the mass gathering unless if not
Yeah.
necessary, and then
His birthday this but we did not celebrate.
yeah,
How many visitors you have?
two
Two.
guys. That's
Yeah, that's also
enough.
our neighbor and then our colleague as well,
Mm.
like this one.
And but if you have corona also, no need to be tense, especially in Nepal, guys. This one before, right, I explained you.
Mm-mm.
One of the guy was quarantined. He is still not declared as corona positive, but he was in isolation and quarantine. Unfortunately, some other health complication came, like at first they said diarrhea or something,
Mm-mm.
and then everyone health personnel was afraid to go to give health care to him.
Mm-mm.
So whole night he was helpless,
Mm-mm.
and
Helpless.
and at the end
In
when
pain and
yeah,
this one.
when he was taken to the hospital, it was already late, and then he died.
Mm.
So no need to be afraid like that. If you have corona or somebody else has corona, especially he was in the isolation, so doctors should wear some proper PPE, mask, and then
Yeah.
gown, everything.
Shout out to all our doctors and all our
Mm.
the nurses. I just cannot mention the name of my company, but it's not they're not afraid, but it's their duty.
Mm-hmm.
It's their job, especially what you call the noble, what you call this one, the doctor, noble job, if I'm if I'm not mistaken. It's like it's not only the ordinary job. They're coming nearly to the patient, they're examining too much, they're checking everything, because that's patient, that's human, they need help. You're the one can help them. Just wear the full PPE and
Yeah.
do the what you call this one, standard procedures to prevent, or for you to take the virus or like that. They're not like what you're talking about, like in the that doctor or whatever that.
Wala.
Wala. I'm changing my emotion eh. You tell kasi about my colleague eh.
Mm.
So what else? How also we change for me, what we experience being frontliner. Being frontliner is not it's not like it's not our choice. This is our job, and then we didn't know that this time pandemic will come. But you should support the frontliners, guys. You should not like treat us like we have virus as well. In any person, you should avoid this one, contact. Not only with frontliners. Why you are afraid with the frontliners? You think we are the one only able to have the virus? No. In anywhere. Also, you know, guys, also for our colleagues, we're doing social distancing. We are afraid to remove the mask in if we want to drink some water or some drinks. We're not removing our mask in front or beside of our colleague, because we are afraid. Of course, maybe our colleague also has infected already, because there's some cases like that you are infected already but you don't have the symptoms because you have good immune system. We have one doctor like
True,
that.
true.
He don't know that he is positive already. They just trace that he has the contact with that patient that is positive. That's why they do the swab for him. He is positive but he don't feel anything. So it means his immune system, his body is fighting for that virus.
Mm-hmm.
You know, we experience here from somewhere here like that, like they are afraid, like don't come there, there is corona there. Why it's easy for you guys, for some person to tell that don't come there, there is corona there? Because we are frontliners. If there is no frontliners, then who will assist the patients? Okay, let's change. Let's change. I will be the normal and then you will be the frontliner. What else? So that's it, guys. So I hope you will catch some important things regarding mask, how to use how to use properly the mask, how to dispose the mask, how to proper sanitize the hand, and what we share also what we experience during this COVID-19. You want to say something?
Yeah, that's it, guys. Whatever you know you can do to stop this pandemic, you can do from your side.
Mm-mm.
Like avoid going in the you
Mm-mm.
know a crowded place, and
Mm-mm.
properly sanitize your hand. And
And we should support our government as well, guys. We should not be hard-headed. From our own side, we should know, we should help, because first of all, this is from our own sake, not from the government officials. We should help them, not doing, what you call this, not following the rules. If they said stay at home, better to stay at home. What you will do outside, you will just take the virus and then you will bring home to your family. So you
yeah,
want like that. So I hope you like this video. I hope you don't feel boring for this video, because I give all the tips that I can share with you. Again, we are not from the medical field, but as a hospital staff, we are from the in the receptionist. We receive some trainings regarding important things, mass and this one, how we can prevent in very simple way. So I hope it helped you guys. So
that is it, guys. Thank you so much for watching our video. Don't forget to like, comment, and subscribe. And please
Yeah. If
come
you
back for
have,
the next
yeah,
video. Okay.
if you
Also,
have again any suggestion, any video like this video, someone is asking this video to make this video,
mhm.
so you can request also down. We will try to make it, guys. So God bless you. Again, keep safe to all of you.
Yeah.
Bye
Bye bye,
bye.
guys.